with clients building really quickly by doing MI and felt much more competent in my work with folks. But also I am a person in long-term recovery, and I was a person who had a lot of different providers. And the provider that had the most profound impact on me basically did MI, and I didn't know it at the time. But when I began to learn about it, I was like, oh, that's the thing that finally helped me. And again, I would never say that the provider fixed me or anything like that. Like it was a collaborative effort, and I had to do the heavy lifting. But to say that there definitely had experiences that were less helpful and more helpful, and the person who did the MI with me was much more helpful. So it kind of really resonated with me. And I'm going to kind of talk about a patient that I was working with the other day to kind of illustrate some of the examples. So these are the global learning objectives. You've seen these before. What are we going to do with this? We're just going to kind of look at some motivational techniques that can improve adherence and outcomes. And there is, those of you who know, there's hundreds and hundreds and hundreds of studies demonstrating that motivational interviewing is generally more effective than the typical directive interventions that are education heavy and kind of very directive. And it's across all kinds of behaviors. So it's across substance use disorder outcomes. It's across other types of health outcomes. I heard the person would, everything from flossing your teeth to increasing your physical activity, to going from inpatient to outpatient settings, all types of different things. And even in the business world, people use MI strategies in terms of leadership. So it plays in a lot of different realms. And what we look at is the relational and technical dimensions underlying motivational techniques, and appreciate some motivational skills to evoke change talk. So we're just going to touch on a few of these things. So I'm covering IOP a little bit for a counselor who's out, and I was working with a patient the other day where I was seeing her an individual session, and she was talking about that she's still sex work. She's still doing sex work, and while she's pursuing recovery. And some of us might think, well, that seems kind of a tricky thing to do, to continue to do sex work while you are also pursuing recovery. I don't make big assumptions like that. I really don't. I try and I try to wonder, does sex work affect the person's recovery overall? Yeah, I could say it does, but it doesn't matter what I think. It matters what she thinks. And so that's kind of where we'll go from there. So a collaborative conversation style for strengthening a person's own motivation and commitment to change. So, outside of her sex work, one of the things I was wondering was, how come you're here? How come you chose to be here? And she said the thing that people say sometimes, well, I didn't really want to be here. My PO made me be here. And I said, well, did your PO, how did your PO make you be here? Did your PO give you choices? And she said, well, yeah, I guess. I could have gone to jail or whatever. I didn't want to do that. So I chose to be here. And I sort of said, wow, that's a really good decision. So you made a healthy choice. Tell me, how come freedom's important to you? Right? Because at that point, that's really all I know is she doesn't want to do jail time. So at that point, she begins to talk to me about, she does have a daughter who is with her mother. That's with the daughter's with the grandmother, right? With my client's mother, and that she wants to have a good relationship with her, and she wants to be a role model for her. So, I begin to think about that. Okay, this is a person who really values being a role model to their daughter and wants to be a support of the family. So that begins to be kind of my working theory and of how I'm going to work with her about just about everything, because this is what I know what's important to her. And arranging conversations so people taught themselves into change based on their own values and interests. So I didn't jump into this question with the sex work yet, but what I did jump into is asking her, if you were able, her drugs of choice were opioids, marijuana, PCP, and crack cocaine. And I asked her, what would it be like for you to be sober and to be around your daughter and doing some of the things that you would want to do? And she really teared up and said, it would be incredible. Like, I've always been around her, but not with her, which is a kind of a deep way of saying that. Like, she wasn't really connecting to her because she was, in her own words, intoxicated or disconnected from her based on drug use. And she really wanted to have that emotional intimacy. And I even asked her, well, tell me more about, like, what would it be like to be more close with her? What would you be doing? And she gave all kinds of details. She had been an athlete when she was in high school, so she'd like to go run with her daughter. She did that, I can't think what that is, where you run and then you jump in the sand. But like, she wanted to do like that type of thing and like teach her some track and field stuff. So like, that's the deal with MI is you're trying to figure out, why in the world does somebody want to do something that's incredibly hard? And if you know anybody who's ever stopped using opioids, PCP, crack cocaine, and marijuana, that's a pretty tough road to go, right? So you need to have some inspiration. And what we're trying to do with MI is have the person inspire themselves. So seek collaboration with the patient on goals and methods. So this is kind of the idea where your patient's an expert and you're an expert, and you're trying to figure out, how do these two people come together to come up with a decision? So this is where I didn't assume that her sex work, she believed it jeopardized her recovery. So, this is where I kind of go into, well, how do you think sex work does affect your recovery? How do you think continuing to do sex work will affect your ability to build your self-esteem, which is one of the things that she was talking about too? And how do you think that doing sex work, how does that fit in with your idea of being a role model to your daughter, right? And you have to, it's really important to be really neutral in those questions. If we have attitude in our question, that's going to be off-putting. So I could have said, how are you going to be doing sex work and being a role model to your daughter? Like, that's going to not get the response that you would want when you're doing MI. It's much more of a, you're completely ignorant. So it's really more of a, help me understand, like, how do you think the sex work will affect your ability to be a role model to your daughter? Very neutral, and she can go in whatever direction. And, at this point she was saying to that answer, well, and I know that I don't want my daughter to do that. That's not the life. And I want her to see me doing something different. But right now I need money. Right now I'm struggling. Right now I can barely keep a roof over my head. I don't want to be homeless. So this is what I'm doing right now. Right. So she kind of long-term doesn't believe that that's what she wants to be doing in her life. But short-term, she believes that's the only way she can make ends meet. Acceptance. So acceptance is kind of comprised of 4 different elements: accurate empathy, emphasizing autonomy, affirmations, and absolute worth. So essentially, the accurate empathy part is, I did ask her, like, what do you like about sex work and what don't you like about sex work? When you're doing MI, you're typically always starting with asking the person what they like about the thing that we would think is unhealthy. And then you end on, what do they not like about the thing that we think is unhealthy? And you do that for a lot of reasons. It typically demonstrates that you're non-judgmental, that basically you're open to whatever their experience is. And you oftentimes have a way more robust discussion about the negative consequences of the unhealthy behavior when you front loaded it by already wondering about the healthy, or the things they like about the unhealthy behavior. And you can guess what she said about, like, what she liked about prostitution. Or sex work, I should say, that the money, fast, easy, or she would say easy, in her words, fast and easy money. She does like to feel desirable. She believes that that's really the only way she can make money right now. On the negative side, she did worry about how her, like, what kind of role model she'll be. She did, to some degree, think that it might jeopardize her recovery because it did take a little bit of a hit on her self-worth and her self-esteem. And she knows other sex workers who have died in the trade. And she is worried that someone might kill her. And she's been physically assaulted many, many times doing sex work. So you're also trying to, absolute worth. Like, I'm not going to judge her about sex work. Who am I to say? This woman's been through, I don't even know if I would have survived the things she's been through. I'll just go ahead and say she's probably way more a survivor than I am. So how am I going to be looking down on her for this choice that she's making right now, when in her world, these are the options she's had? And by the way, like, the other thing she said is that she never had control over her body in the first place. And you can kind of guess what I'm getting at. Like, she was sexually abused starting when she was a little girl. So, like, my God, right? Like, I don't know, I get emotional. I'm tearing up right now. Emphasizing autonomy. So that's the idea that, like, she gets to decide, right? She gets to make the choice. Yeah, there'll be consequences. The PO can lock her up and all that, but she gets to decide whether or not she engages in treatment. She gets to decide whether she keeps doing sex work or not. She gets to decide whether she keeps using angel dust or not. Those are all her choices. Yes, they're consequences, but she gets to make the choice. And you oftentimes in MI say things like, you know what, you get to decide here what makes sense to you. And I think that's how I kind of ended the sex work thing of, yeah, at this point in time, I hear you. It's for you, it does not make sense to stop doing sex work at this point. Okay, I hear that. Affirmation, catching people being good. I completely affirmed her for being honest about doing sex work. I affirmed a lot of the other things that I affirmed her for showing up to the session, right? Like, it's catching people being good. A lot of times we're in the drug drug business, like we're a cartel. We're in the drug treatment business. We fish for people's dysfunction, and we try and catch people being bad. MI is really a lot about trying to catch people being good to help build people's confidence, right? So compassion, basically MI has been shown to be so effective. People were doing it for unscrupulous activities like encouraging people to get into research studies and things like that with MI. So basically on this note, just stick to your ethical codes. And evocation is trying to get the person to eliciting the person's own reasons for change. So those were the questions, like where I was asking, well, how does sex work fit in with recovery? How does sex work fit in with being a role model? How does sobriety fit in with being a role model? And I don't tell her, wow, you'll be such a stronger role model once you're sober. Because first of all, that's stupid for me to say that. What's important is for her to say that, because she needs to hear herself say out loud, wow, if I can stay sober, I can hold my head high in my house and I can do the things with my daughter I've always wanted to do. That's what's inspiring, not me saying, wow, you'll be really good if you do this. I don't know, I'm in a mood, sorry. So these are some things you want to avoid when you're doing MI. In general, like persuading without permission, like, hey, you just really need to stop. Hey, I need to tell you, you need to stop doing sex work. Hey, you're going to end up in a grave if you keep doing sex work. Like, persuading without any permission is off-putting to people. Confronting people, having a premature focus. So if I was stuck on sex work and that we were going to stick on working on changing that, and she doesn't think that's her issue, that would be premature focus. Labeling people, I'm doing that right now. She considered herself a sex worker, not prostitute. She was more comfortable with that term. Hey, that's the term I use. Blaming and shaming people. And educating people without listening. People almost to a T do not like to be educated without you understanding them a little bit, at least first. So what are the skills of MI? Open-ended questions. I know Dr. Block would talk about this, is a lot of times we ask people at the end of an encounter, do you have any more questions? And that almost is inviting people to say no, because there's a power differential in the room. We all know that people are oftentimes not as forthcoming as they would want to be with providers because of that power differential and shame. So when you say, do you have any other questions? It's going to be really easy for them to say no, even though they might have some. So another way of asking that is, what other questions do you have, right? It's more inviting. What other questions do you have? Affirmations, again, that's the catching people being good. Reflective listening are these long statements that you make about a person's experience. So, so an example of that was when she said, I'd feel a lot more confident in my family and like I could be a better part of the family if I were to be sober. And I said something like, wow, you could really hold your head up high. It's not exactly what she was saying. I was kind of saying something in a little bit of a different way that was trying to empathize with what she was getting at. And similar to that, when she was rattling off all these reasons why she didn't want to stop doing sex work at this point, I said, okay, I get it. That's not a priority right now. That's not what she said. It wasn't a priority. I was kind of speculating and put that out there in the form of a statement. A summary is a really long reflection. So it's something like, okay, on the one hand, you want to continue doing sex work because of the easy money. You feel kind of discouraged about getting money any other way. And it does make you feel a little bit desirable. And on the other side, you don't want to do sex work, at least in the long term, because you're worried you may die or continue to get assaulted, and you won't be able to hold your head as high in your family as you'd like to. Right. So you just kind of summarize, starting with the reasons why they don't want to change, and then ending on the reasons why they do. Informing with permission. So we can try and persuade and educate people, but we ask permission first in MI, and that's a part of collaboration. So if she didn't already know that sex work was a dangerous field, which I've never met a sex worker who didn't know much better than I did that it was a dangerous field, I might educate her about that, right? I might say, hey, would it be okay if I share with you, some of the dangers associated with sex work? And she may say yes. And then I would say, well, the research suggests, and I don't really know about the research on sex work, but if I did, I would say, about 50% of sex workers have experienced multiple assaults by their customers. What do you think about that? So you ask permission to educate, and then you wonder what people think about it. So here's some ways to evoke change talk, some strategies. So evocative questions, that's like a desire, ability, reason, need. Why would you want to stop doing sex work? Ability. If you were to stop doing sex work, how would you do it? Reason. Give me one good reason to stop doing sex work. Need. How come it's important to stop doing sex work? Elaboration. I alluded to that earlier. So when someone says like, well, I want to have a better relationship with my daughter. Yeah, what does that mean? Wax poetic for me, please. So that's where I say, well, tell me more about what that would be like. And it's that story. It's a story, right? Like, I used to run track, and I would love to teach that to my daughter. It would be really fun. And I used to talk to, that's when I felt most free, right? That's the story is what inspires people. An example. So I didn't go there with her, but I could have said about the sex work thing, well, yeah, I've been assaulted before. Give me an example of one of the most recent times, right? And for her to talk through that might be upsetting enough for her to begin to develop that discrepancy to where she's more inclined to make a change. Decisional balance, we talked about that a moment ago, the pros and the cons. So what do you like about going, why would you not want to go to 12-step meetings? Why would you want to go to 12-step meetings? Why would you want to divert your or your buprenorphine naloxone? Why would you not want to divert your buprenorphine naloxone? Why would you want to keep smoking marijuana while you're taking buprenorphine naloxone? Why would you not want to? So you always start with, what do you like about the more problematic behavior or the unhealthy behavior? And then you end on, what don't you like about that problematic behavior? Looking back, so a lot of times in this field, I ask people, tell me about a time when you were sober. What was that like? What were you doing? What worked for you? How'd you feel about yourself, right? And I don't care if somebody tells me 2 days. If somebody stayed sober for 2 days, they know how to stay sober 3 days and 4 days and 5 days, right? They've at least learned some things. Looking forward, so I don't like the miracle question. I know a lot of people do, but I'm not a fan of it. I typically, because people tell me about Bentleys and things like that, and I'm like, okay, I don't know what to do with that. So what I do is do something like, if our work together went pretty well, what would be different in 3 months from now? And that gives me a sense of like, what do they really want to see themselves being in 3 months, and how can I help them get there? The query extremes, so that's like something like, what's the worst thing that happens if you keep using heroin on the street? What's the best thing that happens if you stop using heroin, right? And you get people to tell their own scary story. Importance and confidence rulers, I use these a ton. On a scale of 0 to 10, 0 means not at all important, 10 means very important. How important is it for you to stop smoking crack while you're engaged in treatment? And they say, I'm a 4. And I say, okay, so kind of middle of the road. How come you're a 4 and not a 2? And you always ask the lower number, because that's going to evoke whatever reasons why they're thinking about making a change. And if they give you a 0, guess what? You learn they're in pre-contemplation, and you also get to empathize with that. Okay, that's not at all on your radar, or okay, that's not at all important, or that's a really low priority for you, right? You just reflect back that that's not something they're thinking about. And then you ask confidence too. On a scale of 0 to 10, how confident are you that you could stop smoking crack while you're in treatment with me? And you ask importance, confidence, because people who study motivation believe that motivation is comprised of importance and confidence. And I totally believe that. If a person's going to make a change and do something recovery oriented, they have to believe it's important, is going to lead to something that's meaningful to them, and they have to be confident they can do it. You all have had patients who said things like, I know smoking is killing me. I'm coughing all over the place. I hate how much money I'm spending. I've tried 1,000 times. I can't stop. They're telling you they know it's important. They're struggling with confidence. On the other side, you've probably had people who have said, man, I can stop smoking whenever I want to. I just don't want to. That's a person who they're at least expressing confidence, but they're saying it's not important, right? And interventions are different. If someone has low confidence, you're trying to work on building their confidence. If someone has low importance, you're trying to make it more important for them. So it's kind of helpful to know where they're stuck, or else you're just spinning your wheels. Exploring goals and values, sometimes that alone is inspiring to people. Just asking people to think about what's really important in your life and what are you doing to get there. Sometimes that question alone, because all of us right now on this call are not completely in harmony with our goals and values likely. It's aspirational, right? And when we kind of think about, wow, I really do want to be healthier, it can be inspiring. I'm not going to get into the efficacy part. You'll get the slides though, but for time, I just want to go ahead and get to some practice stuff. But there is definitely research to suggest that MI is effective in the medication for opioid use disorder realm, just like there's research to show it's effective in all kinds of other health behavior changes. The other thing I would say is that the other research about MI that's really important is that it is really it's the outcomes are very much affected by how good the provider is at the skill. So there's this, in this reference sheet, you're going to see this, there's this motivational interviewing treatment integrity scale. So basically what that is, that's a tool they use in randomized clinical trials to determine whether or not the person in the treatment condition, AKA the MI condition, motivational interviewing, whether they really did MI, right? And that's kind of one of the interesting things about randomized clinical trials for psychosocial interventions, unlike other types of pharmacological treatments and things like that. You're always wondering, well, did the person really get the dose, right? Like, was the person any good who was doing the psychosocial intervention? So they have the scale that was developed years ago and is in the 4th iteration at this point. And the research suggests that, and it's all provider focused. They don't think about the client at all, aside from your response to the client or patient. And basically the higher you score on that scale, the more likely your patients are to have changed over time. So it is like, MI is something like, if you're gonna, you need to work at it to get effective at it. And it seems simple, and in some ways it is very simple, and in some ways it's very hard. I've been doing it, like I said, since 1996, and there's days when I'm awful at it, or with clients I'm awful at it, and there's times I'm like, whoa, I never thought about it that way, and I learn more. So anyways, let me just say, it is 21 Hive is our CME